We're going to be talking today just about male fertility, how to optimize it, and fertility planning. We're going to try to tackle a bunch of questions, make it an easy listen for you listeners.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin.
This week's episode is titled Planting the Seeds of Fatherhood, Male Fertility Optimization and Fertility Planning. My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. Justin, I see that you're repping the Miami Hurricanes today.
Oh, yeah, baby. When this comes out, we will already have started college football. I'm going to be going to the game on Sunday, so hopefully by the time this comes out on Monday.
Who are they playing?
They are playing Notre Dame under the lights on Sunday night.
Wow. All right.
So it's going to be a fun game. So I'm repping them right now. When this comes out on Monday, hopefully we will be 1-0, but who knows? We'll see.
Okay. But I also know you're a big Rutgers fan too, right? Are they
Yes.
supposed to have a good season this year or no?
I think their over-under is 5.5 wins, which is typically every year 5.5 wins. Their season starts, we're recording this on a Wednesday, on Thursday. So the line is minus 14.5. They usually start off 4-0, 5-0 for the season, and then they just hit their difficult schedule and just get absolutely destroyed. But it's Rutgers, baby. We got to root for them. Original place of college football creation.
That's a fact that I really could care less about. but hey, look, we've been kind of in this that rut of summer where look for you baseball fans, sure, baseball's on, but most sports have kind of been in this lull, and now we're gonna start picking things back up with college football, NFL football, and eventually we get to the NBA. It's gonna be great.
Absolutely, it's finally that time of year, baby.
All right, so look, we're gonna be talking today just about, again, like the title said, just about male fertility, how to optimize it, and fertility planning. We're gonna try to tackle a bunch of questions, make it an easy listen for you listeners. So I think you're gonna learn a lot, and it's a quick summary if you just want to catch some of the headlines about what you can do. And to kind of get started, I'm gonna ask you, Justin, all right, so how common is couples infertility? And how often is male factor involved? And define those terminologies I just kind of asked you.
Right. So couples infertility is really defined based, unfortunately, on female age. But assuming that the female partner is under the age of 35, we're talking about a couple, having unprotected sex for about a year or longer is the and not achieving a pregnancy is the definition of couples infertility. If you're above the age of 35 to 40, it's 6 months. And realistically, if you are your female partner is above the age of 40, we really do recommend you start evaluation right away. Now, we have these definitions really because it is a good guide for a lot of couples on when to seek further help on their family planning journey. And obviously, we're going to go into depth about, is that too long? Is it too short? When should we really start thinking about these things? But couples infertility is quite common. It's seen in about 1 in 6 to 1 in 7 couples, and I'm sure that everyone has talked to a couple who has struggled with this. It feels like it's becoming much more common, and to some degree it may, because we just gave you some age groups, and we do know that people are having kids at a later age. They're focusing on their careers, and there's nothing wrong with that, but it's just the reality of the situation. We know that fertility rates are declining, so it is becoming more popular, or not more popular, more common. What percentage of the time, though, are male factors involved? Well, there's 2 people to have sex, and believe it or not, 50% of the time there is a male factor involved. 30% of the time, it is strictly a male factor. And this is so important to understand because most of the time, unfairly, the female partner is put the burden on. Oh, you have to get worked up. It's your problem. It's your issue. and we neglect the male partner. And that's why we're here today, to really highlight things that the male partner needs to know, needs to understand when it comes to family planning, and hopefully their female partners as well. This may be helpful for, to motivating a lot of the guys who don't want to hear this stuff or don't want to know these things.
Yeah, I think that was an excellent description. I just want to highlight again, it can be kind of confusing, even myself, when I'm looking at it from a male fertility specialist perspective. But, you'll see like male factor is involved in 50% of cases. And then male factor isolated is found in about 20 to 30%, as you mentioned. But what does that mean? I have patients come up to me and be like, what does that mean, doc? Like, why are there two distinct numbers? Again, as Justin was mentioning, it takes two to tango, as he loves to say, right? And so on the female side, they could have a little bit of a female factor going on, and the male factor may be having. And so at that time, both things could potentially need to be addressed to kind of help from the infertility perspective. But that's what they mean whenever like you see a bigger number where it's involved in 50%, but isolated where just that is the actual potential cause of infertility is found in about 20, 30%.
Very important point, and very, very important in understanding that idea. Now, this is what I'm very excited to hear your thoughts on. Okay. We discussed this idea of couples infertility, 1 year for couples with a female partner under the age of 35, 6 months for 35 to 40. And then 40, we always recommend someone, the partner getting evaluated, the male getting evaluated. But when should, in general, a couple start thinking about their fertility, or when should a man start thinking about his fertility?
That's an excellent question. I'm going to answer this as Dr. Kevin Chu, who's read some guidelines and stuff like that. And I'm going to then answer as Kevin Chu as maybe was a patient in the past or something like that. So first off, most important thing that we got to remember is that from a male side, the sperm lifespan takes about 72 days, right? So that's approximately 3 months. So first off, if you learn off of anything that may be occurring, that maybe, as we'll talk about later in the episode, lifestyle or something like that, you better be addressing that 3 months ahead of time of what you're planning on or hoping on conceiving, because it takes that long to kind of see the effects represent itself within the sperm health. So that's one. So at minimum, 3+ months ahead of when you want to conceive. Now, I think first off, if you have to change a lifestyle habit, that doesn't happen overnight. That takes time. So you should probably account for that too. So you push that back, I would say like 6 months. And, a lot of people actually say about a year before you want to plan to conceive or, are thinking about it, you should probably start thinking about your fertility. Now, I want to say in our current time and age where you have access to so many things, right? You can order a semen analysis, which we'll again talk about the importance of it in the male fertility without talking to either Justin or I. You can just hop on the internet and get that information. So we're also going to talk about how this may reflect your health. We all want to be healthy people. You don't have to be 60 years old to decide, hey, I want to be healthy now. I think it's a good idea to probably start thinking to be healthy, since you're born, but we're not thinking about that. So 18 years old, 18 years old, I think is a good age where look, it doesn't hurt to understand and see that your fertility is okay. So for me, I think from a doctor's perspective, I'd be like, look, 1 year ahead, think about it. If you're 1 year ahead of, planning on trying to conceive, start thinking about your fertility, think about what you can do. But for me, I think data is powerful. And in a time and age like this, get it whenever.
Yeah,
Justin?
I think this is it. I think you bring up some really good points. And I think that at least a year before you really want to start planning is a very, very good one, because I think about how many people come to us. They've been trying for a year, 2 years, and they've been doing something that was easily correctable,
Yeah.
that could have been fixed in the beginning. And we're going to talk about a lot of those lifestyle things that could be fixed. But I'm also seeing more and more guys coming, who are saying, hey, I just got engaged. My wife and I, we're going to get married in about a year, but I want to know what my fertility status is. I'm seeing guys who are 18 to 21 years old, sometimes coming in with their parents because they were diagnosed as children to have varicoceles, and they want their children to know what their fertility status is. This is becoming more popular. So I think to some degree, the answer really should be, if you're interested in learning about your fertility, which, like you said, is really learning about potentially your health, I think it is a very reasonable thing to do at any time in your lifespan, right? And I think that if you wait, per the guidelines, wait for a year, and then you find something that could have been corrected, well, guess what? You wasted a year potentially of your time. And we've already established that for guys, and we'll talk about male age later on in the episode, but for guys, it's not as big of a deal. But for your partner, it is. And that 1 year or 2 years or 3 years of trying could really make a big difference in your overall fertility window and your family plans. So I agree with you, Kevin. I think at least a year, realistically, before you want to start family planning, going to see a doctor, and seeing what's going on, checking your health in general, because it is so important, and your fertility is a reflection of your overall health. And I'm going to lead this right into the next question for you, Kevin, because I think it's a natural segue here. Is my fertility indicative of my overall health? And if so, how?
So we are starting to see more and more, and there's a good body of evidence that is showing that male fertility is a good reflection of your overall health. We tend to see patients who have, I'll say subfertile semen parameters having an association with, poor markers of health. All right. I actually went in and took a look. I was like, all right, let's, we say this all the time. Let's just go back. Let me refresh some of this data. Dr. Eisenberg, Stanford, great male fertility specialist,
brilliant guy.
does some great population-wide studies. They're excellent. So back in 2014, he did a retrospective study, 12,000 men. He, evaluated for infertility, and lower semen volume, sperm concentration, sperm motility, total sperm count, and total mobile sperm count were all associated with a higher risk of death. All right. Association being the key thing, not correlation, but still, right? You're starting to see some trends here. And, and in that paper, if you had 2 or more abnormal semen parameters, it actually resulted in a 2.3-fold higher risk of death. So, that's not to scare people off or anything like that. But again, I think it's a window, it's an opportunity for you to kind of take a look at and see like, hey, is there something we talking about all the time with erectile dysfunction, right? If you're having shown some erectile dysfunction, maybe you're talking a look about like your blood flow. Maybe your heart needs to be checked out. So yes, I think fertility is indicative. Justin?
I agree. And I think that one thing that, if we can make it simpler for guys to understand, is that one thing that is very important is testosterone in fertility, right? And so anything you are doing lifestyle wise or health wise to compromise your testosterone, you are more than likely compromising your fertility. Diabetes, obesity, right? These are things that are linked with, I think lower sperm quality, or associated with, and it goes back to what you were saying, right? So it is a really important marker that you can use for your health. We have a lot of people saying your penis is the most important marker for your health. We have people saying your testosterone level is the most important marker for your overall health. Maybe it's your sperm that's the most important marker for your overall health. But it's just, as you said before, I think it's another great marker that we can potentially trend and get access to. And a lot of people are coming in, getting at home semen analyses, and they're coming in saying, hey, what's going on here? I'm interested in my health. And guess what? A lot of the times we find stuff that's going on.
I'm just smiling here because you mentioned, you're like, look, some people say the penis is the most important. Some people say the sperm is the most important. Some people think the testosterone. Guess what, guys? Dr. Chu and Dr. Dubin are specialists in all areas of that, just FYI.
It's true. It's true. It's true. So, yeah, I mean, it's important.
Yeah. So look, Justin, I'm going to ask you this question, so well, we're talking here about how important it is to kind of understand your fertility and your reproductive potential. When should a patient go see a doctor? And to follow that up is who should they see?
Yeah, so this is important, right? Obviously, we've already said some guideline things. I think if you've been trying for a year when your partner's under the age of 35 and you've had no success, if you've tried for 6 months and your partner's from 35 to 40 and you've had no success, or if your partner's 40 or older, you should automatically go get worked up. And that includes your partner getting worked up. But other things that people don't think of, right? If you and your partner have suffered from multiple miscarriages, or you're going through the
Mm,
IVF process and your embryos are failing to progress,
mm,
right? If you have known health issues that may compromise your fertility. Things like a history of cancer, history of chemotherapy, radiation, history of a varicocele, which is an anatomical thing. If you're taking medications you know will compromise your fertility, like testosterone, which we'll get into and we've harped on for a long time. These are all indications for reasons that you should sooner than later go to a doctor to talk about your fertility status. Who you should be going to realistically is a male fertility specialist, which is a urologist. Now, we have a very good relationship with reproductive endocrinologists, which are OBGYNs that are the female specialists of the female fertility. And they do a very good job and they're very helpful in often being the point person for the man to get that referral or to find the person that they need. And because sometimes it can be overwhelming and it can be hard, but oftentimes you do get a semen analysis if your partner is going to an IVF center, and you can ask them if you're not sure where to go for a male fertility specialist, and I guarantee you they'll give you someone to go to. And I think that that's a good point person in your journey for navigating your fertility, because a lot of times guys don't know where to go, and not every urologist truthfully understands the full fertility workup. Kevin, what are your thoughts?
fabulous answer. A couple things on that. First off, yeah, it's one thing is we just like you said, not every urologist may be necessarily nuanced in some of the things. They may be more focused on other specialties of urology that, you and I are not as well, abreast with, these days. So, but if you live in a rural area, look, that doesn't mean you don't go see a urologist. Go see a urologist. They're going to be able to get
Yes.
you that. And nowadays, again, we live in a world where we're connected. You can hop online. You'll be surprised. You hop online, you can probably find people that offer you telemedicine that gets you access to a reproductive urologist. So you're going to be able to talk to them online. They're going to be able to take care of you no matter where you are. Um, and I always think back to our episode with Dr. David Keynes, where we kind of talk about, researching about urological issues, and also talking about like how to do research about your doctor, right? So things with the male fertility specialist, again, what you mentioned, make sure it's a urologist that you're seeing, making sure that they got some specialization in there, and just having an understanding of who this doctor is that you're going to be able to see will really kind of help you establish that trust going into that visit. um, I think this kind of leads into the next question, and I just want to kind of link it together because the next question is basically, what a workup is involved, right? And we talk about this so many times on this podcast, right? There's three core things that you need essentially on a male fertility eval: a thorough medical history with a thorough physical exam, in particular in the genitalia area, a semen analysis, which to me is really the reigning gold standard of
Mm-hmm.
male fertility, and then, if indicated, some hormonal labs such as testosterone, FSH, LH, estradiol, and some other ones if needed. But the reason why I'm harping on this, and the question that I asked Justin was, when should you go see a doctor? Again, we're stressing here, semen analysis is one of the driving things that kind of gives you an overall picture of your health, as well as also an um, uh, it's part of our workup also to kind of, for a physician to kind of go to you and be like, hey, this is what we think of your reproductive potential. You have really no barriers these days. I'm stepping outside the guidelines
Yeah.
here. You have
Yeah.
no barriers today to getting a semen analysis. You hop onto, wait, you know what? We had a previous sponsor episode by Fellow. You hop onto meetfellow.com and you can get a semen analysis without a doctor prescription. You just order the test. You order a cash. Maybe there may be some ways to get insurance to cover some of it depending on your plan, but you get that and you're going to get a excellent report. And, and even then, they also have good referral systems that kind of guide you if something's happening to someone locally that may be able to talk to you. So, Justin, I just think that, yes, you should go see a doctor for everything that you thought of, but also if you listen to this episode, there's nothing holding you back from getting a semen analysis as well.
I think this is an incredibly important point that I agree 100% with, because there was actually a great article that I sent you that came out in the New York Times, I think this week, that men are just not going to the doctor, right?
Yep.
Men are just not going to the doctor. Kudos to Dr. Lee Ponsky, who's an awesome dude who's got this men's health clinic thing that they're doing at University Hospital. But the bottom line is they just don't want to go. They just won't. We suffer in silence, to quote Dr. Mo Kara. But we do like things that come to our door, and we do have an opportunity to at least give ourselves an excuse to go to the doctor. And how do we do that? By checking our health at home. And this is an excellent way to do that. This is an excellent way. If you're not a fan of going to the doctor and you are worried about your fertility and you just get a semen analysis from the comfort of your home and it says, hey, there's an issue here, I'm sure you're going to go figure it out. Why? Because you're going to share that with your partner and she's going to get you there if you don't go yourself. But this is just an easy, low threshold, low risk, completely private way to get a little bit of insight into your health that I think, with all the media surrounding our issues with fertility, our declining sperm rates, is just a really nice way to reassure or inform yourself of your fertility and your overall health, and maybe give you the kick in the butt that you do need to go to the doctor. So I agree with you. Really, there is no excuse to not have a semen analysis at this point, even if you're interested in fertility at all. And I think that, I think this is the way that we're going. And I think that this is, the guidelines don't say that.
The brakes are off.
I think, I mean, like,
the brakes are off.
We both agree. Right. Go ahead.
The brakes are off. The brakes are off. Dude, even hormonal labs, man, you don't even need to wait to have your doctor order them. We can hop onto a bunch of sites these days that can get it to you with the click of a button. You're going to get sent to a lab and you're going to get all these. So your patients, I mean, this is a fantastic time to be a patient, right? You got it. It's all there. You hit a button, you're going to get those labs, you're going to have the information. Now, that said, it's still really important if you're seeing some aberrations. Well, I'll take that back. Even if you're not seeing aberrations, it still probably makes sense to talk to a male fertility specialist, because there's some things that aren't measured that we understand about, and something that Justin mentioned where, like, hey, if let's say you've had recurrent miscarriages or recurrent IVF failures, and but all your numbers seem fine, and so you never. But I think there's still situations it's important to talk to a male fertility specialist, because there's a little bit more of a second level that we can kind of go into, where it's important to understand that, hey, maybe there's some things that are not being measured, or there's a test that's not conventionally done, such as like DFI testing. So I still think it's important, but you are now more armed with getting that information quicker and getting an idea at the comforts of your home.
Yeah, no, I think this is, and listen, Kevin already told you, like, what's going to happen when you come to see a doctor. He already told you. It's really nothing crazy, right? We talk, we touch your balls, no finger in the ass. And then guess what? We do a little blood work and you ejaculate into a cup at home, most likely. So, it's much less invasive, much more casual than your female partner's workup. And if you haven't gone to see what your female partner is going through, you should, because, it's a lot. And when you see what they go through and what we just talked about, you've got to walk in the park. And the least thing you could do is go talk to your doctor while your partner is getting checked up.
Love that, man. Love that. All right, let's get into the next question, Justin. So, what guys are at higher risks for fertility issues?
Yeah, we brought this up before, but it is really important to understand when you're contemplating, when you should start uh, planning for your fertility or trying to understand your fertility, that there is a group of people or a large group of people who are at higher risk for fertility issues, right? If you have a history of cancer, we already said, chemotherapy, radiation, very big deal, right? Those are potentially can compromise you. If you've already been diagnosed with a varicocele, while it doesn't impact everyone, it can impact the fertility of people. If you've had any issues like testicular surgery in the past, orchiopexes, undescended testicles, these are things that you really probably should get assessed for. If you have things like cystic fibrosis, it's we're at a point, and we've had some really great interviews with Gunnar Esiason. Definitely recommend going back to that, looking there. But they are fertile, but they cannot ejaculate the sperm, right? They don't have vas deferens. If you have something like Klinefelter's disease, there's some other genetic issues that can compromise your fertility. This is just a plethora of them. If you have other, pre-existing conditions, poorly controlled diabetes, obesity, I think that these are other indications of you getting checked. Also, testosterone usage. If you've been on testosterone, we're seeing it more and more. These guys have been on it for 5 years, 10 years, thinking when they're in their early 20s, it's not going to be an issue. And then they come after trying for a couple years and never knowing. So, I mean, that's my list. But really, once again, I think there's things I'm probably missing. But there is a lot of people out there who potentially have compromised fertility. And now, hearing that list, I do want to say, is this something you should be freaking out? Does that mean that I'm sterile? No, the answer is no. And this is what I tell a lot of my patients, right? There's probably 8 billion, maybe 9 billion people on Earth, right? 4 billion, let's say, are men. 1% of men have no sperm in their ejaculate. I don't think we have a good percentage of understanding how many have low to very low sperm. Maybe you know a number. I don't think that there is one. But think about hundreds of millions, it must be, right? Hundreds of millions, if not tens of millions of people with low sperm count, have all the things we talked about, and probably never got identified, and have multiple kids, conceived naturally, and it's not an issue. We just have these biases nowadays, right? And sometimes, but identifying these things early is still going to be helpful and still important in your fertility journey. So, I mean, it's nothing you should freak out about, but it is something you need to address.
I think you were spot on. Did you mention undescended testis? Did you?
I did.
Yeah. That's one thing I feel like so many guys, even when I'm doing like a male fertility assessment, like towards the end of like, oh yeah, dog, I think I had some had to fix and orchiopexy. Like it's that one has been shown to have like some mild increases in infertility. So that's just one. Again, any history of that, I always tell guys just get semen analysis early on.
Yeah,
Really
and
know.
what about guys with one testicle? Should they be worried? Sometimes
Well,
it's not necessarily from cancer. I'm saying not from cancer. Some people just got one
they
testicle,
just have
whether
a
it died.
solitary testis.
Yeah, solitary testicle. Say they had undescended testicle that died, or something like that.
Yeah, I mean, I think that still falls into that same risk category where you have a slightly increased chance of infertility. Again, just get a semen
Yeah,
analysis,
I
and
agree.
I get many times. And you made it such a great point. Again, like we're saying these things in percentages. None of these things are like you're sterile, right? Like every single person that has an undescended testicle is sterile. No, not at all, right? It's just an increased risk. Just means you should be increased chance of thinking that there could be a potential chance for infertility issues. We know plenty. We know personally guys who have solitary testis, have many kids, no issues, right? So
Yeah. He should get a vasectomy. We should vasectomize him.
yes, we should. Yes, we should.
I would say we each do one side, but there's only one side. All right. So that was mostly like predisposing factors, Kevin, we were just talking about. Now, lifestyle
Mm,
is a really, really important thing when it comes to fertility because there's so many things you can do or you shouldn't do that can impact your fertility. Um, let's start off with one of the biggest things because I think that I like to talk about this one because this is one of the most common reasons why I see guys with a very low sperm count because you have these guys, they're very, very healthy. They're
yeah,
doing everything right. They're
yeah,
following all the bro podcasts and they're doing the hot tubs, they're doing the saunas, they're doing
yeah,
the steam rooms.
yeah.
Um, but and the data suggests that those things can be good for your health overall. But when
Right.
it comes to your fertility, this wet heat exposure can be a major problem. So tell us, Kevin, why does hot tubs, saunas, steam room, jacuzzis compromise male fertility, and why should men not be doing it?
First off, I would like to kind of think that we get classified as a bro podcast as
Yeah, yeah,
well.
yeah.
So the bro podcast over here is telling you, hey, look, those are probably good for other parts of good health, but not good for your sperm health. So let's talk about why. So first off, as you may have noticed, if you've looked down, if you're a male and you've looked down, your scrotum hangs down away from the body, some more than others, some less than others, but it's away from your what we call your core body. And the reason for that is because sperm have been identified to be optimized or generally needed to be able to live and to grow and stuff at a temperature that's below your core body temperature. It's about 2 to 4 degrees Celsius, somewhere around there, below your core body temperature. So if you're going into a jacuzzi, into a sauna, or into anything that's going to increase the temperatures of these areas, you're bringing that temperature up and you're going to impact that sperm health. So that's why it's, important, especially when you're trying to conceive, trying to kick some of these habits. That's one of the habits. I think that's one of the first ones on the top of my list is like, hey, are you using jacuzzis? Or hey, are you using a sauna? It's important to stop that because it could be adversely affecting your sperm counts, sperm parameters.
Yeah, I agree, and it is an easy fix. And just simply, you are cooking your sperm. You're cooking them to oblivion. They're dying. They can't handle that temperature. You're not only going to your body temperature, you're going above your body temperature. And I get a
Go
lot
way
of
up.
pushback. Yeah, I get pushback sometimes because people are like, oh, well, it's really good for you, though. I don't want to stop. It's like, listen, I understand. Is it going to compromise the fertility of everyone? No. How many babies have been made in a hot tub? I guarantee you a lot of them, right?
A lot.
But which also kind of makes me not want to be in a hot tub sometimes. But at least a public hot tub. At least a public hot tub. But I got one outside of my apartment. I see the people in there. I don't really want to go on it. But the point still remains, if you're talking about optimizing your fertility, right, this is something you shouldn't be doing. I can't tell you how many guys I've seen, and I'm sure you've seen, who we had them stop it. 3 months later, they went from very low to very normal
Yeah.
parameters, and they were very happy, and they didn't have to go through IVF. They didn't have to go through anything. It's a surprisingly easy fix for something that uh, is causing a big problem. I actually have a couple guys here in Miami, believe it or not, who do tanning beds as well. It's like we don't have enough sun here, but tanning beds I would also stay
Wait,
away
in
from. So
South
I'm going to
Florida?
include
Not
that.
enough,
Yeah.
not enough sun in South Florida?
Oh, dude, listen. I'm a Jersey guy. I'm not ashamed to admit I had a tanning salon membership like when I was 16 to 18. We've learned. I don't do it anymore, but it's still a thing, I guess, to some people. But you should not do that either. I categorize that in that department as well.
Well, let's go the complete opposite way, right? So look, lesson from that, like heat exposure, hot heat exposure to the scrotal area, especially with these jacuzzi saunas, just not good. Justin and I have seen patients who are their occupations, unfortunately, don't, can't get them away from heat. And we
Yes.
suspect that probably, I think you talked to me about a cook. I've dealt with
Yes.
patients who dealt with wildfires and stuff like that. So, it's, look, though, for them, that's their job. Getting into a jacuzzi, probably not your job. Just one simple thing. We're not telling you for the rest of life, but again, during that time you're trying to conceive, it's important. But let's go the other way, right? Now we talked about heat. Why don't we talk about um, also very popular on bro podcasts, these cold plunges, right? Hopping into those freezing water. So Justin, educate the listeners. What's the latest on cold plunges, and do they harm fertility?
This is a hard one because
Mm,
you're in LA, I'm in Miami. Everyone loves the cold plunge. I've cold plunged, it's fine. Like I'm not against it at all. And people really love it. Go enjoy your cold plunge. But when it comes to fertility, the answer is I don't know. And I don't think anyone knows. There is very limited data. There's no data on humans on fertility, and there's limited data on animals that has suggested maybe it causes a problem. Now, uh, from my personal perspective, I would just assume that going from, if one extreme temperature is bad, I would assume
mhm.
the other extreme is bad. So I personally tell my patients to stay away from cold plunges if they can. Now, obviously, if their semen analysis is normal and it's fine and you've been cold plunging, go live your life. But I don't have any data to support or go against it. But let's be honest, cold plunging is not life and death for people. So if you have to choose to do something to stop it for a little bit, it's not a big deal. And I would recommend holding off on cold plunges until your fertility journey is done. Thoughts, Kev?
I completely agree. I mean, the whole idea. It's extremes, right? You're real bad high heat, as you said, bad. You would then just think, and it makes sense, that really cold temperatures are also probably bad. Um, One thing I'll stress is, you can see many things online, and you'll see people who stay, an N of one, which means like a study of one that they did on themselves, and they'll be like, actually, look, if you did it, like, you can see my semen parameters, and they've improved. Again, like it's. Yeah, as many things in medicine, and we're going to talk next about like cigarette smoking and stuff like that. Like, what are we saying? Like, people who smoke cigarettes never have kids? No, of course they do, right? And so it's again, it's probably harmful. I think for most patients, there's probably patients who it's not going to have any effect on. But like Justin said, time is valuable. And so if it's something that you can potentially just kind of sit out, I don't see any benefits to your sperm health that it's doing. It just probably has more harm than benefits. So yes, it'd be something that I would say abstain from if you can during the time of
And
conception.
also, by the way, that specific person, and we're not going to say, that specific person put ice on his balls when he was in the hot tub or in the sauna to prevent the worsening of quality of his sperm.
Oh yeah, that's
That
right.
does not mean that the cold plunge works. And honestly, just if you think physiologically, when it's too hot, your balls drop to get cold, to get cooler. And when it's too cold, they get closer to your body. Dude, they can't get any closer. They're going to go up to your fucking tits in a cold plunge. So you're kind of fucked there. I mean, just to be honest, right?
I mean, some people argue that the transient nature of it, that they're like usually when someone sits in the jacuzzi, they're probably in there for like 30 to like an hour potentially, like a long time,
Yeah,
versus
yeah.
like
Sure.
cold plunges, so people argue like, okay, it's transient. You're just jumping in. You're not, you're just given a shock. But again, like who knows? It's very hard to measure these things.
Yeah, for sure.
Um,
All right. So let me ask you. You kind of already alluded to it. Let's talk about smoking, vaping, and marijuana. We had a great episode a long time ago about this with Dr. Rena Malik. Go check that episode out if you want. But to talk about the general men's health impact of all these things. But how do you counsel your patients when it comes to smoking, vaping, and marijuana? I think we all know the answer, but go ahead.
yeah. So the one thing I always harp on, and I tell my patients, kind of what I just mentioned previously in the cold plunges. Again, are there patients or are there people out there who smoke cigarettes, who've never seen a male fertility specialist, never even talked to a doctor, who have many kids? Yes. Are there people out there who vape daily and have many kids? Yes. Are there people who go out there who smoke marijuana, who use marijuana in any sort of form, have kids? Yes. Right. So again, from that perspective, it's not a very absolute, right? It's not absolute saying like, oh, this is 100% going to cause infertility. That said, there is evidence. We'll first talk about cigarettes and vaping that show that they impair or have a negative effect on your semen parameters, right? You look back at this study in 2010, 6,000 men were looked at. Almost people who were moderate heavy smokers had an almost 10 million decrease in sperm count and a 5% decrease in motility. When you look at e-cigarettes or vaping, right, this was actually interesting. This was shown in 2022. Your sperm DFI of non-smokers was significantly lower than that of e-cigarette smokers, and versus also regular smokers as well. So look, it's cigarettes, vaping, in general, to have a negative effect on your sperm parameters. I'm gonna focus on the sperm parameters. Marijuana, I think we talked about it where the data is kind of like a little bit on both sides, but again, I usually tell patients if you're already sitting here in my room, you guys have been having trouble, maybe something to consider. But that one, the jury's kind of out, at least in my eyes.
I don't know. I actually think that for marijuana, I think it's a little bit controversial, its impact on testosterone more than fertility. I think that heavy marijuana consumption
Fun.
leads towards infertility more. But I agree with you because the problem is it's almost impossible to define what heavy consumption is, right?
Right.
Because first off, you don't know the strength. Every weed's different, right?
Yeah.
Is having 5 grams a day edible to a 10 milligram,
Right.
5 milligrams, 10 milligrams, is smoking a joint versus a split versus all these things like on a
Right.
daily basis versus once a week versus once a month. A game breaker? No, I don't know. We don't know. But I can tell you that if you come in and you say you have 4 blunts a day, like,
Fine. Fair enough.
I'm like, dude, you should
That's
probably
not
chill out,
moderation.
right?
That's not
And but if you're saying, hey, I have like a joint once a month, I'm usually like, that's probably going to be fine. Like if that's what you need to get through, sure. Ideally, if you can cut it out, you can cut it out. But I've seen guys who do sauna every day. They smoke a couple joints a day. We stop those things and their sperm comes back to normal. And it's pretty amazing. Which one is it? I don't know. But I've seen guys stop marijuana, significantly decrease it, and their parameters do go up. I have seen it.
Wait, so let me ask you, because I want to know. Because look, Justin and I, we've worked together in the past, whatever. But I've actually never like seen him with a patient. So like in these situations, so how do like patient comes in? Let's say they, have smoke cigarettes or they vape occasionally, or you do marijuana occasionally. What is the exact thing you say to them? What do you counsel to them?
No, I'll say, listen, when it comes to marijuana, I believe that heavy marijuana consumption can potentially compromise your fertility. Now, I'm not saying it's going to make or break you, but especially because I can't define to you what heavy consumption is. But if you like, and then I say, like, this guy is like, okay, I smoke like 3 joints a day. I'm like, I would say that probably qualifies. And
Yeah.
they're usually like, yeah, I agree. I was like, can you cut it down to one? Like, I'm not telling, like, because I think that, like, it's, you have to be within reason for people.
Right.
Like, I think going cold turkey for most things, no one's going to ever
Yes.
do that. Right. So I think that an idea is setting a goal for reduction instead of stopping it completely, right? If you're like, hey, I smoke a joint once a month, I'm like, okay, whatever, man. Like it's fine, probably. If you don't need it, maybe just don't do it, right? Like, but that's kind of how I approach it with my patients. Is that how you do it?
Yeah, pretty much, man. Like again, I do the big thing where like, look from an outside perspective. Look, we know smoking has negative effects on you. We know like vaping has negative effects on you on a health perspective, right? So you should be decreasing that no matter what,
Correct.
right?
Correct.
That's the recommendation, anyways. But you make a valid point. Like it's very hard for people to get to like cold turkey. It really is. It's a process. And so for me, when I counsel from a health perspective, look, you should be trying to in moderation or at least really try to decrease those if you can, right? We it's evidence based there. If you're sitting in my office, there's probably even more reason because you guys have been
Great
unsuccessful
point. Great point.
in trying for a year. Someone's referred you here. Your semen parameters are off. These are now like even more highlighted. It's even more important to really try to attack these things. And so that's generally my
I think
recommendation.
it's an excellent point. I think that's an excellent point. You're there for a reason.
Yeah.
You got to try something. We're here to try something to improve it. So, I mean, when you're in the office, then what are some other lifestyle measures that you recommend that your patients do to optimize their fertility?
The usual doctor bullshit. Just,
It's true. It's true,
I'm
right? It
sorry.
is true, but it's true.
Yeah, so the things I tell patients are is like, look, are you eating a healthy diet? Very important. Are you exercising regularly? Not too intense, not doing like, 3 a days or something like that, but are you having good exercise throughout the week? And are you getting good sleep? Those are the main three things. There's been studies shown that, patients who are obese have worse fertility outcomes, right? Or have higher
Yeah.
chance of fertility. It's the rise is probably due to hormonal, issues like your testosterone
Imbalances.
is
Yeah.
lower if you have more, if you're more obese. And so those three things are integral to actually having good testosterone. We talk about a whole
Yeah.
separate space, separate from male fertility. We talk about it from like a, ED perspective. How do you maintain good testosterone levels? Those are three things. How do you have a good heart? Those three things, right? It's like everything's related to those three things. So besides everything else we talked about, those three things are the foundation, right? Of making sure that you are stepping your right foot forward when it comes to optimizing your lifestyle. Justin.
Yeah, I think just to make it simple, you need to have sex in order to have a baby in general, right? Like that's your
in
goal.
general, in
And
general.
if you are a fat guy who can't move, can't do anything, you have low T, and you got a bad penis because you're not getting good erections, guess what, brother? You're in trouble for fertility. But it sounds funny, but how many guys have you seen who come in with insanely poorly controlled diabetes? The hemoglobin A1Cs 12, 13, they're more sugar than men. And they're coming in there saying, my erections aren't good. My ejaculate volume, nothing's coming out anymore. And these are things that we actually see in people who don't take good care of their health, right? You got to, in order to have a baby, without doing IVF, you got to be able to have sex and you got to have something come out of your penis. And having bad health, having poorly controlled diabetes, these things aren't helping those things. So you can, so it's just something to think about in the background, right?
Spot on, man. Spot on. We're going to leave it right on that. Look, we're going to go to the next question here. It's a topic you love talking about. We're going to talk about, and it's a common thing that gets brought
Question.
up
Yeah.
to us on a daily basis, because finasteride, many guys out there may be taking finasteride in the reproductive years for hair restoration. You've noticed your hair is thinning out, and it was shown that taking a low dose finasteride can kind of help in some of that hair regrowth. Justin, we do know that, or do we know if finasteride has any impact on your fertility?
So I know you added this question because you know how I feel about it. So I my stance is I am an anti-finasteride person. I'm an anti-dutasteride person. I think that the 5-alpha reductase inhibitors are just bad. I think that they're bad for your body. Even in older people, when we give it for BPH, there's that increased risk, I believe, of dementia and other health issues. There's something called post-finasteride syndrome, which, while very rare, once you see it in a patient, you really don't ever personally want to give finasteride to anyone again, right? And there actually has been articles coming out because now all these DTCs are giving it out like candy, that less than
It's out there.
1%. Guess what? When you're giving 20 million people finasteride, that less than 1% is now going to be 2,000, 3,000, 4,000, 5,000 people getting it, right? And so, post-finasteride syndrome is, decreasing your libido, depression, erectile dysfunction, and we don't really have any labs or markers to really quantify that. It's you treat it symptomatically, it's pretty miserable. So for those reasons alone, I was out on finasteride. But now we do have patients come in, they are on finasteride. And listen, like majority of people don't have that issue, right? They don't. But I don't want to be the person to give that person that issue. So I don't like giving it. I think, a minority in that. I will agree. I will loudly say I'm a minority in that. And I'm not saying that it's a bad decision for you. But when it comes to fertility, the question really becomes, does it compromise your fertility? And the answer is maybe, right? I think we don't have a full grasp on this. I think it's still controversial. The data that has come out shows that in men with low sperm count already, a known low sperm count, those who are on finasteride, it compromised their fertility, right? The studies basically, they stopped the finasteride in those patients and their sperm quality got better. But I don't think there's very strong data on men with normal sperm parameters. But if you were to come to me as a patient and say, hey man, should I stop finasteride? I tell you, stop finasteride no matter what. But if you're talking about fertility, I would lean towards yes. I would say yes. If your semen analysis is normal, then sure, why would you stop it? But if your semen analysis is low, we already have data suggesting that stopping it may potentially improve your parameters. So why not stop it? Go on oral minoxidil, go on topical minoxidil. That's what I take. That's good. And it's cheap. Kevin, what do you think?
Oh, wow. All right. Well, we got the Justin opinion. Now, first off, I'm not so anti-finasteride as much as Justin is, but he makes some excellent points. Um, the patients I do treat who are dealing with like the post-finasteride syndrome stuff, it's a tough way out, right? And for
Yeah.
some guys, it persists no matter what
Years. Yeah.
we try. Um, And a lot of times it's also not linked with the duration of medication. At least anecdotally, I don't even know if
I agree
that's
with you. No, it's
evidence.
not. Sometimes people take a very brief amount of time.
Take it briefly and then they just immediately notice changes. So look, this is not the topic that we're talking about here today, right? It's this effect on fertility. I tell guys again, you just get a semen analysis, right? Just get a semen analysis. If you're on it, you're thinking of it, whatever, just get a semen analysis. And if your semen analysis is normal, I think it's probably fine, but something that you should probably kind of, look, if you've tried for a year, something hasn't happened, get another semen analysis. Let's make sure something hasn't happened, right? So for me, because I know how important hair is for guys. It's one
You're
that,
right.
and it
You're right. It
helps,
is.
and it helps guys out, right? Like, I have many friends who are on it, and works fantastic. It helps reverse some of that. So it's a weighing of risks and benefits kind of thing. But I think as long as you're not having any effects from it, and your semen parameters look fine, I generally say like it's okay to stay on, in my
But
eyes.
what if it's low? What if your semen parameters are low and you're on finasteride?
Well, you pointed out that great study, and I usually go with that study, and I'd be like, look, you probably should stop it at that point and go on the topicals, not the topical finasteride, because that still shows some systemic uptake, but like topical minoxidil or oral
Yeah,
minoxidil.
I take them both, and you just know the oral also makes your body hairy. But I'm a hairy
Whoa,
person
whoa, whoa,
anyway.
whoa. Wait, really? I did not know that.
Yeah, it does. It's a
Because
systematic. It's a
it's not
systemic. It's a
focused. It's
systemic hair growth, dude. Like the topical's only on your head, but actually, it makes your whole body hairier. The
wait,
oral, I believe.
but oral finasteride, is that also too, or is it? Well, I guess
No,
DHT is
because
mostly focused on your.
because the DHT receptors are have a different distribution than how
Gotcha.
minoxidil works, which I have no idea how minoxidil works. Actually, I don't really think I know it all. But
I,
yeah, but we do know how finasteride works, and the distribution is in your head. So, and your prostate, obviously, are the two really big places. All right, so this is a big conversation that we're going to talk about next, because this is something that comes into our office. It's a question we get all day, every day. Supplements.
Believe it or not, in couples struggling with fertility, male factors are involved about 50% of the time. So if your partner's getting evaluated, you should be too.
And beyond getting checked, there are real life changes that can help, like eating better, exercising, and potentially taking the right supplements.
Now, we've talked about fertility supplements before, and some data shows they can improve things like sperm count and motility.
One product with clinical backing is the Bird and Bee Male Fertility Power Pack. It includes coenzyme Q10, zinc, L-carnitine, folate, and other antioxidants that can support sperm health.
Now, it's vegan, gluten-free, doctor formulated, and made with bioavailable ingredients.
They also have female products. So if you're trying to conceive, make sure to talk to your doctor and also check out Bird and Bee supplements.
That's birdandbee.com, birdandbe.com.
So there is data suggesting that supplements can improve your fertility. So we've had an episode on male fertility supplements, and we recommend you go back and look at that for sure, where we go really in depth for a whole hour on the episode. But what supplements, Kevin, do you typically recommend for fertility optimization, and do you recommend supplements in the first place?
So controversial, right? But I think we were talking about this beforehand, before we got on the podcast. And I think it was something that kind of really stuck with me that really I think is important for this, right? The fertility data is hard. Fertility data is hard
Yeah.
because you gotta, you're looking when you want to do it, as scientists, which Justin and I are, we're back at some point in our lives. It's it's very important to structure in a way so that way you minimize confounding variables. Man, that's hard in fertility, right? Science, right? You gotta address the male, address the female, because ultimately we care about the birth, right? We're not necessarily caring about your semen parameters going from, adding another 10,000 sperm count. Who cares really at the end of the day if that doesn't lead to a live birth? So that's why there's like so many confounders. Lifestyle is hard to track for a lot of patients. Again, because we talked about what is mild smoking versus moderate smoking different for different people. So that's what makes studying fertility hard. And, and so supplements, which are widely available, you can get, you don't need a doctor's prescription for it generally. That do they really 100% improve your male fertility potential? And the data is sparse on that, right? There's data that actually goes both ways. But what Justin said to me beforehand was like, look, for the most part, supplements do not have any negative effects on a person's body and their health. And so if you want to, there's probably really no downsides to taking it, right? And look, you ask me, I take supplements. Justin, you take supplements?
I do take supplements.
I have my supplements stacked. I do, And so I think, so on that note, where I say do I recommend supplements to my patients? I do. I go look, am I saying that this is 100% going to help you? No. But again, if you want to put your best foot forward, I don't think it hurts to take some supplements. And the supplements that I recommend for male fertility improvement are things such as CoQ10, which is, there's data suggesting it improves sperm motility. I suggest omega-3. I suggest zinc. I suggest L-carnitine. And I suggest basically your vitamin profiles like vitamin A, vitamin D. Again, if you want to know specifically what each one of these do, we talk about it for a long time with Dr. Asenad in the episode. But Justin, did I hit the big ones? I don't know if there's any other supplements.
Yeah, I usually say a daily multivitamin, which covers a lot of the vitamins that you mentioned, the CoQ10, the zinc, the L-carnitine, the folate. I think those are really kind of the ones that.
But sometimes the multivitamin doesn't cover everything, so that's why there's some more tailored.
It's a multivitamin plus those things, and shout out also to Bird and Bee. They have a male fertility power pack that has pretty much all those things that we talked about.
Right.
And they've made it very accessible a great little supplement packet that you can go check out on their website, Bird and Bee. So I wanted to give them a shout out for sure about some supplements that they've actually done some clinical trials in ensuring that they're doing really good quality supplements. Because one thing that's important is, remember, these are not FDA regulated, so we want to make sure that you're getting a good quality
Yes.
product, and
Yes.
often ask your urologist, sometimes your reproductive endocrinologist. They can give you some good guidelines on what supplements, what companies are actually best, and I think that that's actually an important point. But to what you've said, I agree 100%. What I tell my patients in general is it going to hurt? The answer is no. The only thing it's going to hurt is your wallet, because it costs money, right? Is it going to harm you otherwise? No. I think that, is there a potential to be beneficial? Absolutely. Will we be able to say that that's the thing that makes or breaks you? I don't think so. But when a patient comes in and they say, hey, listen, I want to do everything that I can to optimize my fertility, I don't think you're being fair if you don't include mentioning supplements, right? I think that it's something that you should be mentioning, and it's a conversation you should be having. And I think, it's just one of those things that you can potentially use to help improve your sperm. Thoughts? Is that a fair summary there?
I think that's a very, very fair summary. So let's lead to the next question. Uh, and right here, we're going to talk about fertility and testosterone. And who better to talk to than Dr. Justin Dubin, who's published very well on this, very well, an excellent paper, must say. But let's talk about, the role of testosterone fertility. We harp on this like fuck ton of times, all right?
Yeah, dude. I mean, like,
But
we
it
could
doesn't
go.
hurt. But we all, we always have it's new listeners all the time. So I'd love to kind of re-educate. So Justin, talk to us. Testosterone, TRT, fertility. What's going on?
Just very simply, you need testosterone to have sperm, right? It's an important component of sperm creation. So it doesn't make sense intuitively when you hear, wait, taking testosterone causes infertility. I thought you just told me that you need testosterone to make sperm. You do, but where do you need that testosterone? You need the testosterone to be in your testicle where sperm is made. And when you take testosterone exogenously, meaning, from some kind of prescription or injection, a gel, or a medication that you're taking, it's one of those things where, your brain recognizes that you're having enough testosterone, and it shuts off the signal to your testicles. It pretty much says, hey, we're making enough. You don't need to make any more. So it stops the signal to your testicles. Your testicles stop making testosterone, but they also stop making sperm. So I think that this is just something that, you just don't know until and unfortunately, we see a lot of guys who are not educated. They're not given the appropriate risks on taking testosterone and its risk for infertility. The data shows about 65% of guys after being on TRT for only about 4 months have no sperm in their ejaculate. But you can recover, right? And this goes back to the original plan here, right? After about a year of being off of testosterone, 90% of guys have return of sperm to their ejaculate. After 2 years, 97%. But imagine being a guy who doesn't come to see a urologist and who ends up actually, wasting a year or 2 years trying to have a kid on testosterone, and they have a very low sperm count to no sperm count. But, that's where we come in. So this is something that can be corrected. It's something that can be fixed, but you have to talk with a urologist about it.
On that last note, I feel I'm starting to become more fearful of that statistic. At first, it was always like I felt like we were stressing, like, oh look, like 10% don't recover, 10% recover. I feel like a lot of these clinics are saying like, yo, 90% recover. It's okay, bro. Just get on it. You're gonna be fine, right? And that is like, it's 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 not fine, Justin. You and I we see the patients, and then like we put them on recovery, we do everything, and there are times where it just doesn't come back. And look, this like I treat fertility as something that you should treat preciously. Your reproductive potential, treat preciously. Like there's people out there who never even took testosterone, are struggling, go through IVF and all that stuff. So um, that's one of the things I really, and Justin, maybe I'm wrong. I think if you're at reproductive age and you're thinking of any testosterone, you got to speak to a urologist. You just got to speak
Absolutely.
to, just
Absolutely.
speak to one.
And one thing is, we think about no sperm, but the other thing here is you're talking about cost. Forget about all that stuff. You may be making the difference between IVF and having a natural conception, which is, guess what? You may not suffer as much, but your partner's going to go through IVF. You guys are going to spend a shit ton of money. So it's not just like having a baby or not having a baby. It could be the financial, physical, emotional cost, the relationship cost. So these are a lot of things that you may not be accounting for in this process. But obviously we talk about this a lot in a lot of our episodes. We have a great episode that reviews.
Yeah.
Go ahead.
And I want to go on one thing too. I'm just thinking of it right now. Also, one thing is it is not, and look, I'm not trying to misguide patients or misguide guys out there and say you shouldn't be on testosterone therapy. But once you are on testosterone therapy, it is very hard to get off.
Yeah.
Also,
Yeah.
it just is, right? It's extremely hard to get off. And so again, and when you mentioned the word stress point, right? That can become a stress point in your
Yeah.
relationship.
Yeah.
And you don't want that to become a stress point in your relationship. So
Oh,
just some
dude,
food
it's
for
so
thought.
hard. Yeah, it's great because a lot of guys are like, dude, I'm never fucking coming off. It's like, dude, then you're never gonna have a fucking kid. I don't know what to tell you, dude. And then the wife is like, I'm gonna get a fucking divorce because this is the next step. And it's true. But I do want to end on one final question. I mean, we were gonna talk about microplastics. We've had a whole conversation about that, already.
Yeah.
We talked about female partner age, but what about male partner age? I do want to just quickly bring this up because I think it is an important point that we haven't discussed on the podcast really ever. So how important is male age when it comes to fertility?
It's an excellent question. So yeah, you're correct. I think most conventionally, right, we always think, female age, male age has no impact whatsoever. That's a conventional thought process, right? Female age, you start, they'll in the medical terms, you're going to be labeled as advanced maternal age starting at 35 and after. All right. That's medical terms. That's not from me. That's not from Justin.
I didn't. Glad you didn't use the G word there. Geriatric.
No, I didn't say that. I didn't say that. And then, 40, 45, but that's because we see there's, decreased egg qualities that start happening, decreased egg numbers, which happen across those age ranges. In males, conventionally, it was always thought that none of that ever happened. But we have evidence to suggest that things can occur as men age, right? I think, look, and you correct me if I'm wrong, I believe for the most part, from a semen parameters numbers perspective, for most patients, nothing's really happening till around 50. I don't know if that's correct, but about 50 years and after, that's when you start seeing some sperm decline or sperm counts decline. That said, if you look at, and I'm putting doctor hat on, but if you look at the guidelines from the AUA or ASRM, which govern this, so basically there's a line there that says that men who are over the age of 40 years old, should be counseled that they have a potential for increased risk of adverse outcomes. All right, fertility outcomes. That's in the guidelines. And what does that mean by that? There's actually a big chart there that kind of goes through certain things that may become impaired. Could there be an increased chance for genetic issues to occur? Yes, that can occur, and that is affected with advanced. And now I'm saying advanced paternal age. That's anyone over the age of 40. All right. Things from I believe like your semen volume does kind of slowly start decreasing.
Yep.
Testosterone levels are decreasing starting after the age of 40. So that also can impact your, again, sperm health, if you want to take a look at perspective. And there's been many studies done that show that increased chances of miscarriage occurs in men who are over the age of who are of advanced paternal age. And that's just a few of the things. So as we see more of the data coming in, yes, I think you should understand that, yes, advanced paternal age is linked with some more increased chance of adverse outcomes.
Yeah, absolutely. It is a real thing, and we never thought about it. I think that we really started conceptualizing this probably in the last 10 years, but you
Yeah.
still see people like Robert De Niro, Al Pacino, uh, having children in their late 70s, early 80s, which is, God bless them, whatever. But the truth is, yes, in your late 40s, 50s, exactly what you said, your sperm quality starts to decline. There's higher risk of miscarriage, higher risk of having birth complications, like pregnancy loss, and then as well as potential birth defects. Now, people are like, can you quantify this? Is it like 10 times? No, we can't. It is just known like it's a trend, right? Does
Yeah.
that mean that you shouldn't have a kid as you get older? Absolutely not. And I don't think anyone would counsel you otherwise. It's like, I would never counsel a female who's 40 or above. Why would I counsel a male to not have a child? Of course, if you want to have a child, you have a child, but it's another reason for you, if you haven't gone to the doctor by the age of 50, to go see a doctor to make sure everything's going okay. These are all considerations. It's just another trigger point for you to go see a doctor to talk about your health. And I think on that, I think this is a great episode. I think we really hit a lot of good topics that I think is going to be really helpful for people who are starting the family plan or interested in optimizing or learning more about their fertility. Any comment and concluding statements, Kevin?
No, man, my concluding statement from my perspective, again, is that, look, everything is at your fingertips these days. If you have the financial means to, you are able to get these tests without really having a doctor in. So, if you don't want to go in and see a doctor, you don't want to go into the waiting room, you can get a picture of it right away. And nowadays you got podcasts like ours. We're telling you what supplements to take. You don't even have to pay to see us. You don't have to even sit down and have a visit with us. It's right there. We're telling you. But we understand how guys are. That's why we made this podcast. So, hey, as long as everyone's optimizing, that's all we care about.
Yeah, I agree. I think that that's a really good point. I mean, we went through pretty much a counseling session for each one of us here, literally asking, how do you counsel your patients in the office? So, but yeah, you're right. I think that knowledge is power. And I think that if you are interested, you're obviously interested if you're listening to this podcast, that even if you're scared to go see a doctor, go check your sperm, go check your labs, and maybe that'll invite you to go see a doctor at the end of the day. Because realistically, the bottom line is, this stuff is helpful, but you should still go see a doctor at the end of the day if you're interested in optimizing your fertility. Okay.
Correct.
And other than that, thanks for listening. Until next time, enjoy. Please download, subscribe. We're really getting close to our hitting 1,000 subscribers on YouTube. We really want to hit that marker, then beyond. We're really trying to focus on that. My good quality camera's kind of fucked right now, so I apologize for that. But download, subscribe, give us a review, 5 stars, comment. We're trying to improve our audio quality. We hear you guys on that, and we're sorry about that, but we're going to keep trying to improve that as our production gets better, which we anticipate it getting a little bit better, and we have some good fun plans coming up in the next few months. So thanks for listening. Until next time, for Kevin and Justin.